what's going to happen?
Yeah, basically it's a brand new video. We'll just start right over.
Hopefully people pick up on that.
Yeah. Okay, but it's live.
Are you sure it's live?
Yes, I see the live back.
Okay. Folks, I understand we had a little bit of a disruption in our broadcast, so should I start over again, Chris?
Yeah, I think, because we got about a minute and a half into it.
Yeah, let me just start over again. So again, it's today's Tuesday, April 14th. I'm joined here with Jeff Fink, who runs the Kendall County Emergency Operation Management Center, and Jeff has been in Kendall County for a little over 50 years, 50. Thank you for joining me this morning. So just want to start over with what our numbers are in Kendall County. Last night we learned we got our 12th active case of COVID-19 in the county. Of the 12 that we have, 8 are fully recovered. 4 are considered active. The one we got yesterday is a little bit different because it's called community spread. And so right now, of the 12 cases that we've had, the 4 most recent ones are all in the city of Boerne. So the 4 active cases that we have right now are just in the city limits of Boerne. There was 1 in Fair Oaks, and there were 4 others in Kendall County. Those have all been recovered, and we had 3 others in the city that are recovered. Jeff, let's try this again. Maybe you could just talk about how you are Kendall County's point of entry of information from DSHS, that's Department of State Health Services. Maybe you could just talk about how that process works.
Well, DSHS contacts the emergency manager of each county if they have cases in that county. The exception to that is if the county has a local health department, then they do it a little bit different through the health department. But all the emergency managers in every county get notification that there's cases in that county, whether they be in a municipality in the county or the county itself. They give us a little bit of information to help us protect our responders should they get a call to that area. The other thing is they were pretty good about telling us how the spread was, whether it was travel, close contact. There's so much community spread happening today that they're pretty much no longer telling people that where it happened or how it occurred, because they're saying it's everywhere. So community spread means that you have it in your community, and you just need to be a lot more careful and safe when you're out in the public for whatever reasons you may be out.
Great. Yeah, community spread, when we were fortunate that we hadn't had any community spread, which means they can't pinpoint exactly where it came from. Community spread just means don't know. And so the assumption is, like you just said, assume it's in your community. And now we have to be really, really diligent in terms of how we take precautions and how we protect ourselves, and more importantly, how we protect others.
And if they know where this person may have been or where they may have left some exposure, they will try to follow up. But there again, it's so widespread across communities that it's just almost impossible to do that today.
I had an email this weekend from Jeff, and he was asking me, is there a process in place to notify those who may have been in close contact with the individual who had community spread? Can you maybe address that?
There again, when epidemiology does their investigation, they ask the person where they've been, who they may be in contact with, what activities they've been involved with. And if they can trace that back to, hey, they went to this particular store, they were with this group of people, they will follow up with those groups of people or places to say, hey, you had an exposure or a positive person in here. You may want to take some disinfectant measures and that and clean the thing before you allow the rest of the public back in. But there again, community spread is becoming so widespread, for lack of better terminology, that it's just, you got to assume it's everywhere, and you just got to take the precautions.
Right. I think a great example of DSHS had done their homework was when we got notification about the UPS store here in Boerne.
Correct.
They said, they had been right there at this specific time frame, and maybe take some extra precautions. So I think DSHS has a very good protocol and process they follow. But if it's, one of the things that I've noticed is people don't even know they're carriers. They say, I was feeling fine, and I had no idea I had the problem or I had COVID-19. So I think we'll talk more about that here in a second. Jeff, you and I were talking earlier. You won't be able to see this very well on that page up there, but what I'm going to do is just show you, this is a distribution of the age groups. I'll give that to you in a second. It shows who all is being affected in Texas. Now, this is just looking at the state of Texas. And as I'm looking at this, the largest age group that's being impacted right now is 20 to 60-year-olds.
Correct.
Now, early on, we had heard that the people with underlying symptoms were the ones that needed to be concerned about COVID-19. Maybe talk a little bit more about what you guys have been talking about from an EOC standpoint.
Well, COVID-19 can affect anybody. If you have underlying medical conditions, there's a higher death rate that goes with that. So a lot of people over the age of 60, 65 do have some of those underlying medical conditions that makes it a little bit tougher to survive it. Those people in those younger brackets, they're the same thing is if they have some underlying medical conditions, this disease is a lot more harsh on them, and it's a little bit harder for them to recover, and a lot of them don't recover. And I think some of the confusion is they were talking about the older, 60 and older, and it's a higher death rate for those individuals than it is for the younger ones. The younger ones have a better recovery rate, but the older population has a lot. And a good example is what's happening with the nursing home in San Antonio and some other counties, is the death toll in some of those facilities is high because of the age and underlying medical conditions. Where there's younger populations that have been a lot of contamination and infected people, they are recovering again unless they had some medical condition that prevented it.
Right. So it affects everybody. It hits people in different ways. For those that still want to compare this to the flu, this is not the flu. The flu attacks the body in a radically different way. COVID-19 has a much more severe attack on the lungs. That's been proven, and that's the big concern we've had. And what we're trying to do, again, it's for those that want to continue to compare this to the everyday flu that we have every year, you can't compare the two, because the flu has a vaccine. We don't have a vaccine yet for COVID-19. And so the measures we're taking for this continue to be preventative because we haven't figured out how to stop the spread. And the only way we know how to stop the spread are with the measures we've been taking, which is social distancing primarily. If you're sick or you have symptoms of fever, stay home. And then we'll talk about masks here in a second because we're about to get on there. I know, Jeff, I continue to have tough conversations with my family. My in-laws, who are both in their 80s, are bored out of their mind. They love going to the grocery store, and they keep calling me every day. They say, Timmy, can I go to the grocery store? If I put a mask on, won't I be safe? And I have to continually remind them, it's not about, the mask doesn't protect you. And no, you're in your 80s, and you shouldn't be going to the grocery store. We'll go to the grocery store for you. I don't know if you're having those conversations in your house.
It's not too bad. My mom's doing a pretty good job at staying at home, and she'll call us if she needs something from the grocery store. So, but you know, the older population, that's their way of socializing. So it's tough on them to not be able to get out and visit.
This is nobody's enjoying this. Nobody at all. I guarantee you, I'm not enjoying this time. But let's talk about. So we have a bunch of masks on here. The whole thing that's going on right now is a discussion about masks, and I wanted Jeff to be on here specifically so we can talk about, what if I don't have a mask at home? Where do I get a mask? What should I do? When should I wear a mask? So we're going to talk a little bit about that. But the most important thing, when the CDC guidelines came out almost 2 weeks ago now, and they said you ought to wear a mask if you cannot guarantee social distancing between you and the next person. And what they said in there was a mask is not to protect you, it's to protect others from you in case you might be carrying COVID-19. And that's the whole point behind this. So, Jeff, I thought maybe I could start with one, you could start with one. What kind of a mask should I be wearing? Here's something I have. It's just a simple bandana. This happened to be from the Cattle Barons Gala, but if I wrap that like that and I put this around my face, is that good enough?
That'll work in the public, yes.
Yeah, so if I needed to have a mask on, and I need to cover my nose and my mouth, right?
Yes.
Because if I do it like this and I'm just covering my mouth, I'm not really protecting others.
It's not effective.
So you might see me at the grocery store looking like this. What are some other examples you might have?
Well, there's several different types of cloth masks. These were made by people that donated them to the community, to EMS. This is similar to a surgical or a procedure mask. This one is a little different. It has the nose cup that fits over you and it ties. This hasn't been finished yet because it can be adjusted to the person's size, but you can get online. There's more information out there about how to make a mask to protect yourself in the public. These are simple masks. You see a lot of painters and people use this. This is very effective if you're out in the public. What we ask you to stay away from is these type of masks, this is an N95. This is also an N95. This is more for hazmat work, but it will work in this environment that we're in today. But these are the type of products that we ask you to keep for the healthcare providers, because there's such a demand for them that's what's running short. These homemade style, these cheaper masks like this, that's what we're asking the public to merge. This is not a surgical mask. This is what they call a procedural mask. It's a little bit thinner than a surgical mask, but if you go in and maybe they're going to remove a mold or something from you, this is what the doctor in his office may wear versus a surgical mask. So but it's good if you have access to these to use in the public. Again, a lot of healthcare workers use those just preventive in the hospital or medical setting to save the use of the higher grade masks if they need to. So there's all kinds. I mean, I even got a special one here. I was a little disappointed they didn't send me the ingredients to go with it.
Is that a Crown Royal bag?
So you can make it just about out of anything. Couple things to remember though is to use a mask, you want to use it when you're going out in the public. It's not required today, and if people will practice this today and in the future when they're out in the public, then we may not have to make it mandatory. And that's, there's a lot of discussion about that, and it's the people's choice to use them, but if they use them like they should, then they can prevent some harsher rules, I guess, to come down. But when you look at cloth masks, when you're going out to the grocery store, hardware store, the pharmacy, anywhere you're going to be in the public where social distancing is tough, we recommend you wear it. And it doesn't matter if it's, I go to the store and they got where I stand and they got how far I stay apart. There's still a risk of passing those people, or maybe you being infected and you don't know it. So you're protecting one another from each other. But make sure your masks fit snugly against your face. Secure it with the ear ties or the loops, and there's a lot of inventive stuff out there. I've seen headbands that are made that have buttons on them. Instead of putting these on your ear, when you put it on, you just attach it to the buttons. Just different ways to do it. Again, as the mayor said, you want to make sure it covers your nose and your mouth to be effective. It should be multiple layers of fabric, as the mayor alluded to earlier. If you can put this on and blow a candle out, it's not effective. So it should be difficult to blow that candle out. Again, you don't want it too thick because you want to have the ease to breathe through that mask, and that's why they don't recommend it on children 2 or younger, because it's just too hard for them to breathe. Make it so it can be laundered. So if you have a couple of them, you can be washing one, regular soap and water in the laundry works, let it dry. You can either do it in a dryer or just hang it out and let it dry, and you can be using another one. This particular one is just another way they make it, but inside of it, it actually has a HEPA filter from a vacuum bag. Just another layer of protection within these. Some of these can have the same thing in it. It just depends on how they're designed. But again, before you take it back out, make sure it's thoroughly dried and do it. And again, there's a lot of stuff that you can make these out of. T-shirts, scarves, handkerchiefs. My wife's making some out of pieces of fabric and things that she's had left over from some of her sewing projects. So there's a lot of stuff out there, but about any cloth product you can make one.
I have one of these.
Those are popular.
This is what I wear when I go fishing. But just one layer like this doesn't work. This is my panda mask. I don't know if it looks like that, but what I have to do is I have to kind of double it up, and then I couldn't blow out a candle. But yeah, And then I have one that some friends of mine made. Bob and Linda made this, and they found this online. Like you said, you can go on YouTube. This has actually like a gauze filter in there that fits inside there, so you can take that filter out and throw it away. There's lots of examples of these masks, but do I need to be wearing it if I'm driving around in my car by myself?
Not really. Now, CDC recommends if you're gonna drive around and you're gonna have your windows open and that, they recommend that you wear it. If not, you don't need to. Around your house, you don't need to. But if you're going out in the public and you're gonna be around people and social distancing is difficult, today CDC and DSHS says you should be wearing masks.
Yeah, and we're talking about masks. This is a big deal. So you've seen several examples of these, and I've seen even somebody just take an old T-shirt, just cut it, wrap it around their face, and they can go in the grocery store. When I was at H-E-B and Walmart this past weekend, and I was talking to the general managers, both Matt and Cindy, I observed about half the people were wearing masks already. So those people are getting educated on their own. They're wearing the masks. And you know, we had a long conversation this morning. I will tell you all this, that I am drafting the orders now to be prepared to issue a mandatory mask if you are out and about in the city of Boerne. I'm not making that declaration today, but now that we have community spread, and as we talked about on our daily call that we have, where we talked about the community and what's going on, having just one, it's not a reason to panic. It's a reason to recognize we have to have tenacity, and we got to continue to take this seriously. This stuff can spread lightning fast once it starts spreading. And now that we have community spread, it's when we get around other people that we don't live with that things can pass to each other fairly quickly. So part of today's message is we're trying to educate everyone out there. These masks can be very, very important. And again, it's not about preventing you from getting it. It's about preventing you from giving it to somebody else. I hope we don't have to go to a mandatory masks throughout the entirety of, certainly the city of Boerne is where I have the ability to issue that order, but I am drafting those orders. I will be ready to do that at a moment's notice. If we get another case or two of this, I don't want to wait. I know Austin has moved to mandatory masks when you're in public there. Laredo has it in their community, but they have a lot more spread than we do. A lot more. We're down to 4 active cases in Kendall County, and all 4 are in the city limits of Boerne. They have hundreds and hundreds of cases in their respective communities. We were just looking at the numbers this morning. So this is more of a plea to you folks that are watching this. We need to take this seriously. I know that we've been doing a pretty good job. We haven't had a lot of spread in Kendall County, but we have community spread now. And all the preventive actions that we can take right now, if we can not have more spread, then we won't have to take the next steps. Putting masks on at all times when you're in public. Jeff, I got an email yesterday somebody sent me an email on Facebook, and they were talking about where their spouse works in a place of business where their spouse wears a mask, but the coworkers don't. And I know that in a lot of businesses, they're making it optional if you want to wear a mask or not, but some of these coworkers are younger. They don't take this quite as seriously. They're kind of getting in each other's faces, and the person who wrote this email is a person that's under. They're a high-risk individual, and they don't want their spouse to contract it and bring it home, because that would make it, like you said, high-risk individuals are more at risk of more severe problems. I think you and I were talking about this early. Maybe we need the employers to step up a little bit right now.
Yeah, I think if you work somewhere and you have that concern, you've got every right to go to your employer and say, hey, look, I'm concerned about this. There's community spread now. And I think the best precautions for us is to have all the employees while they're working, because there is some close contact that they should wear a mask. The vendors and the owners of these businesses have to step up and take a little bit of responsibility to say, if you're going to do business with us, there's more than one person in here, you need to have masks on.
Yeah. You know, all the orders that we have in place right now, we had put out there early on, I think on March 23rd, when we went to essential only businesses in the city of Boerne. We put out a phone number for you folks to call if you felt like there were situations that you needed law enforcement to come in and weigh in on this. And we had a non-emergency phone number. We'll remind you of that non-emergency phone number. And I think if employees feel like there's unsafe work practices, they should feel comfortable reaching out to a non-emergency number that we have for Boerne and say, hey, can you guys come and just give us some advice? I think that's completely appropriate. We're not telling on each other. This is not trying to get people in trouble. This is trying to protect each other, and I think that's the way we need to look at this. That number, again, is on the city's website, and we have a lot of frequently asked questions that we'll continue to update. If you haven't gone to the City of Boerne's website, I know we have a lot of information about COVID-19 out there. So I think for today, Jeff, I just want to say thanks again for your service to our community. I think for the last, you haven't had a day off in at least 5 weeks since this has become sincere. You've been doing this for over 50 years. Thank you for your service to our community. You've been a first responder, and I think, you know, between the first responders and the grocery store people, in my mind, those are the guys at the tip of the spear every single day, and we got to make sure that we protect everybody. So when you go in public, wear your masks, make sure we don't spread it to others, and we'll update you later in the week, Boerne, with more information. Thank you.
Thank you, Mayor.